Greetings. Digger notes that concerned citizens have banded together to prevent dismantling via privatization of our healthcare system and has news for them: first the bad news, then some good news. This is not someone offering an opinion. Being a scientist, I begin with and deal only with the facts of the matter. Years ago, when our population increase was due to births, we were able to build medical facilities and to graduate enough doctors, etc., to care for us in times of need and provide places for them to practice. Increasing the population by unbridled immigration has resulted in the doctors who were graduated from our universities having their time fully reserved, so they are not accepting any new patients. I need to have someone who grew up in the same circumstances that I did advising me about my health, not someone who grew up in a radically different society where they eat things I would not even step on. There's nothing racial about these words. Those who are fearful for their own lives or the lives of someone they love need to have access to someone they can relate to.
A real-life example is called for now. Here in Vancouver recently, a dental clinic operated by people from the Far East was shut down after infecting thousands of their patients with truculent microbes. The walk-in dental clinic was, in a word, filthy. Did you go there? This is about life and death here, not some gluten-free snack for fatties. Fracking, wake up.
Already the for-profit walk-in clinics, staffed by temporary foreign workers no less, exist, where those who fall ill are obliged to deal with doctors who could have been certified in one of the Far Eastern countries, where it is known that shortcuts to getting a diploma can be had for a price. Take note that I am not trying to infer that medical people who learn their trade in the Far East are messing up. I am only bringing to people's attention that patient-doctor confidence is at an all-time low. Also, walk-in clinic doctors, as a rule, do not accept patients on a regular basis either, so getting sick typically entails seeing a different doctor each time. Acceptable patient-doctor relationships based upon same backgrounds or being confident that the person was properly educated and trained is a thing of the past, and woe betide us all.
This part may come as a shock. It seems that nearly 2,000 immigrants arrive on a daily basis. This has been quietly going on for the past 15 years, so million upon millions of them must also be accommodated in our healthcare system. Our universities are also overcrowded by immigrants and wealthy foreigners learning how to get even richer here at Gold Mountain, so we cannot graduate enough doctors or properly trained support staff. Our debt-burdened governments cannot spare enough of our tax money to expand the medical infrastructure to accommodate current immigration rates. Never mind getting on a bus that is not packed or buying anything whatsoever without standing in long line up.
Hey, this keeps going off topic. Well, not really.
Fine, so I'm back on track here. So all this only leaves those who get into things for profit as a source of funding. If the profit limit is set low by regulation, they will put their money elsewhere, so privatization and deregulation will continue as a consequence of immigration rates. Not because some evil power elite group is attempting genocide. Not because those you empowered with your vote hate you. We note that those the voters empowered to take care of their health for them can all afford to have private doctors and jump ahead in waiting lists while we cannot. Do you love it? Do you hate it? Here it is the way democracy made it. Now that your last source of national pride, the Canadian medical system, has been taken from you by globalists, you must try a less traditional way to achieve a secure future. Let go of democracy, people, and let go of money. Treat them like they are infected teeth. Have the total conscription program part of the plan. Remove both of them for you.
To recap, money for expansion to our medical system at a rate that can accommodate the influx of people via immigration is not available from our debt-burdened government, so privatization of the medical system will go ahead regardless of anything anyone can do, because current immigration rates leave us with no alternative. So these are the facts of the matter, and as such they must be accepted. The image of a dog chasing its own tail comes to mind here. Having accepted the facts leaves one with these three options. 1. Continue going in circles attempting to reform a 7,000-year-old and 2-layer-derived social system. 2. Stick our heads into the sand, just pretend that all is grand, and hope that everything turns out okay. 3. Become familiar with the plan for replacement of our entire social system with one carefully designed by our scientists and engineers so as to not have these kinds of problems.
You may be thinking that even if there were a usable plan for an alternative social system more in tune with the age of job-replacing technologies, that it could not be understood by anyone that does not have an advanced education, or that it might take years to get an acceptable understanding of the plan. Both assumptions are just that. There is a Facebook forum called Technocracy Revolution for discussion of the plan, where hundreds of interested people are trying to learn about it together. There are already more than 100 websites that do a good job of presenting a few aspects of the plan put up by people who are trying to pass on what they have learned. There's nothing special about me, although I am well accomplished, and proud of it. I am just one of these people. It is doubtful that anything this vast can ever be completely understood by any one person, and for sure not through self-study, so I joined the group in whose custody the scientists who engineered the design for a different social system placed it for safekeeping, namely the member-funded Technocracy Incorporated, established in 1933 of Washington State. Selecting suitable documents from their archives and putting them in the proper sequence to assure a comprehensive understanding was the difficult part. Next came the time-consuming tricky part. Making use of the hypertexting and application of advanced guided learning techniques so as to present the information in a way that could quickly be gripped by my peers in the social activist community. This has been made possible, only recently, by having all the files available both in hypertexting and audio MP3 format. This was required so those who are not big-time readers can simply listen and learn. When I said time-consuming, I meant it. Coming up with this presentation took me just over 25 years. It is the major work of my life, second only to being a father. This was a good quarter century for me, as I always had something positive to cling to when things looked dismal. A way to fill my lonely hours. It has kept me sane and fit. Lack of hope can sicken then kill a person. If you have been mortally wounded, having something worthy, positive to dwell upon can save you more surely than the moribund medical system you cling to. And renewed hope will do more for your health than avoiding sugar will. Just now the complete guided learning presentation is only available on a flash drive which I give away. Next it will be on SkyDrive or some other cloud. First learn via a well-written novel called NAFTA. Available on the internet. What to expect after the plan has become reality. Do this before you take up your study of the plan. Then if you can dig the Usufruct Way of Life the ebook describes, find out more. All you ever need to know is available in the flash drive presentation. This book is on it in listening format too. In closing, I will fess up as to what is in all of this for me. I am looking out for myself when I take an active interest in our medical non-system because I might need help someday. I am not out for fame or glory, and I hate money. I have briefly just described my life's work. Having it known to others would be nice, but not necessary. For me it was one, not so small, step in my personal evolution. Will it also be a giant step for humankind? That part is up to our advancing social media and others.